Drug excretion is the removal of drugs from the body. While there are several avenues for drug removal, such as urine, bile, sweat, saliva, breast milk, and respiration, the most important organ in drug removal is the kidney.
Drug excretion through the urine results from three combined processes: glomerular filtration, passive tubular reabsorption, and active tubular secretion. I am a drug going down the bloodstream into the kidneys. If the drug is small enough to pass through the pores of the glomerular capillary walls, it will move from the bloodstream to the urine.
Filtration does not differentiate between metabolized or unmetabolized drugs, but rather whether the drug is free or bound. If the drug is free, it will easily pass through the pores in the glomerular capillary wall. Bound drugs, on the other hand, have proteins attached to them, making them too big to pass through the pores, which allows the drug to stay in the bloodstream.
Passive reabsorption is driven by differences in drug concentration between the bloodstream and the renal tubule. If a drug is lipid soluble, it can readily pass through the membrane and undergo passive reabsorption from the tubule back into the blood. Drugs that are not lipid soluble, which are often ions or polar compounds, will remain in the urine to be excreted.
The final component of excretion is active tubular secretion. In this process, there are active transport systems in the renal tubules that pump drugs across the membrane from the bloodstream into the urine. These pumps are divided into two main classes, one specific to acids and one specific to bases. After the drug has traveled through each of the steps that make up the excretory process, the drug remaining in the tubule will finally leave the body.
While the understanding of how drugs travel through and exit the body is important for nurses in general, knowledge of the excretory process can also help nurses in the diagnosis of patients as well as monitoring them. For example, we can use assessments of albumin levels in the urine to monitor kidney disease progression in diabetic patients. The presence of proteins or other elements in the urine can indicate other abnormalities as well.